As an active teenager, Khalid Ali Haji loved Taekwondo. But an accident practicing the sport last year left him paralyzed from the chest down. There were no specialists in his home country to treat his complex injury.
We spent less than 2 weeks in Bahrain, and then we had to rush. We were rushing to come to Bangkok for better treatment and faster treatment.
He's been making remarkable progress since.
I can walk now. Like, I started walking 2 steps to 4 steps to 8 steps.
The decision by Khalid's family to bring him to Thailand for treatment is not uncommon. Last year, 2.5 million medical tourists came here, and they spent nearly $4 billion. Mostly they're coming from Japan, the US, the UK, and Gulf Arab states. But the largest private hospital in Southeast Asia is experiencing a shift.
We're seeing a lot of growth from the ASEAN countries, from countries like Myanmar, Cambodia, Vietnam, Bangladesh. The thing that characterizes a lot of this growth is it's a country whose economy is growing fast, but the healthcare sector lags behind.
The Thai government has set a goal of becoming the medical hub of Asia in the next 3 years. Many of the medical tourists here are not seeking specialists like Khalid. They come here for lower prices and to avoid long waits in their home country.
Medical tourism is a growth industry, and this government program is looking to expand it even further. But some feel that that comes with a cost, felt by Thais who can't afford care at private hospitals and a drain on medical talent from the public health care system, like this clinic just minutes away from the country's top private hospitals.
The Thai government is protective of its doctors. While many of them study overseas, it's nearly impossible for a foreign doctor to practice here. So the growing flow of medical tourists drives up the demand, draining a limited pool of doctors and increasing costs.
With more and more patients come in, so it will draw a lot of resources from the government hospital, especially the teaching hospital.
And that means fewer experienced doctors to teach the next generation. With Thailand's infrastructure and reputation, it's well on its way to becoming the medical hub of Asia, providing care for people who come here looking for a better future. But some feel the nation needs to balance that with the medical needs of its own people. Scott Heidler, Al Jazeera, Bangkok.